and the recordings has started. That's lovely. So I think, where's he gone? Stephen was going to share the presentation, and I'll just go through that. Is that okay, Stephen? And I'll just ask you to prompt through the slides. Oh, somebody's left the meeting. I'll just wait for Stephen to bring up the presentation. Lovely, thank you. So, Hackney, a place for everyone, person-centred advice grants. Can you go to the first slide, Stephen? So, this work that we've been doing around person-centred approaches really dates back pre-2018 when we started working with the larger providers in the borough. And it really reflects, I think, wider work that we're trying to do as a council in relation to our relationships with the sector, although probably the advice work was a early starter on that one. And I think what if you look at this list of things that we're really very, very focused upon, it could be applied probably to any frontline service, whether it's the council or anywhere else. But this is, I suppose, a set of ways of working that we're trying to apply within our own within the council, much of which is based upon the learning of the work that we did with our advice partners very early on in doing this work, and also the work of our partners. So it's just, I suppose what it is there's an expectation that organisations provide advice. They provide debt advice, legal advice, welfare benefits advice. It's all there. That's the kind of underlying expectation anyway. But the way that we work, the way that we do this work, we're understanding is really significant in terms of how we can help residents. And we've learned that primarily through the work we did with advice providers, just working very closely, sitting together and observing what happens, but also, I think, particularly through the pandemic and the way that we worked through the pandemic. And we don't want to lose that, because we became very person-centred, we became very focused on resolving problems. Our relationships, our way of collaborating, all of those things mattered a lot more than all the KPIs, outputs or outcomes in the world. It was all about, let's just collaborate, work together, use our trusted relationships and support residents. And we don't want to lose that. But much of our ability to do that came from much of the work that we'd done through our advice. So advice really helped us understand what was needed and how we could work differently. So what we're doing here is we're really just continuing a journey. And it is a journey because there isn't, you know, we're learning all the time and we're adapting all the time. But I think these are some fundamental principles about our approach and the way that we want to work with advice partners, plus a whole range of other partners across the borough. Next slide, please, Stephen. So we think when we were working with partners for the last advice grants programme, we really focused on PON to try and strip away everything else that can just get in the way of kind of like what we hear and what we're trying to do. And we came up with this notion of, you know, let's always keep focused on purpose, but let's keep focused on our purpose, because otherwise we can get distracted all the time with all our processes. I'm a bureaucrat. I've worked in local government 30 years. I can get really, you know, obsessed with all the other things that go around this. But at the bottom line is, why are we here? And in terms of advice organisations, we sat in a room for quite a long time, but actually came up with something that was very focused and short. We provide local, accessible help and advice that guides and supports me to resolve what matters to me in a timely, compassionate way. We help residents to resolve their problems and regain independence by promptly giving the right advice and support. And I think we go back to that all the time. If we're not doing that, why are we doing something? Because we need to focus all the time on our purpose. Next one, Stephen. So there's something about relationships really do matter. And I think we learnt that a lot during the pandemic across the council as an organisation, but also between organisations within the voluntary community sector. We saw a lot of collaboration. We saw a lot of organisations getting to know each other who'd never worked together before, but needed to work together in order to protect residents. And so whilst a lot of this, I'm looking at it now thinking, well, a lot of this is from pre-pandemic. It actually is much more meaningful now because I can see where it's happened, and we really need to continue this through the way that we work through the advice system. So it's about doing what matters, doing only the value work, because that's partly about focusing on the client, but also about making sure that with very limited resource and capacity, we're only doing things that really make a difference, and also about seeing cases through to completion and understanding the importance of making sure that we understand when a resident approaches us, we understand their client journey. Next slide, please, Stephen. So measuring effectiveness, and I suppose one of the things that really has changed is one of the things, and we learned this from the advice review, the first working with our bigger partners and then the wider sector, that actually measuring using KPIs and targets and all of these things, they help us to be accountable. They help us to go, oh, look, here you are, you've paid this much money and this is what's come from it. But actually, it doesn't actually measure the success of a experience for a resident in trying to get help. And so we've had to really think about, well, what do we measure? How do we deliver this, knowing that we're doing the right thing without resorting to very traditional KPIs, such as how many housing benefit claims have you worked on, or how much debt have you recovered, or which are still interesting, but don't really tell us much about whether that resident got the help that they needed. So we started to look at different ways of measuring effectiveness, and none of these are set in stone, because there are other ways that you might think would be better, but these are the sort of things we came up with to try and help us understand how effective the service was in helping residents meet the purpose that I described earlier. So these are just an example of them. And what was really of interest, and they're not easy to measure, again, it's not always about what's easiest, it's about we're trying to do what works. It'd be much easier for me to say to you, just tell me how much debt you can recover, just how many people you see in a day, how many people you deal with in terms of a housing issue, that's easy to measure, but it doesn't really tell me much about how that's really helping very vulnerable residents in Hackney. So a lot of these measures and we developed were trying to give us indications of gaps and where people maybe came in and didn't get help, but understanding why. And there might be a really good reason for that, but they needed help. So where did they need that help from? So we try to really look at measures differently, because the measures should always be about learning, about helping us to learn, to change and improve, rather than just trying to quantify what you're doing. And much of this is predicated on trust. So it's about trusting organisations. I don't need to count how many advisors are in the organisation, don't need to count how many people you see. It's interesting because it's not that it's not of interest. I think but it doesn't really tell us, or you as an organisation, how improvements can be made and how we're really going to help very vulnerable people in Hackney. Stephen, next slide, please. And these are just ways of, there's lots of different ways we could look at it, but this is the ways that we chose, we started by looking at. So we talk about things like value demand. And that's where you're basically doing something, an activity that is helping the resident in relation to that purpose. What are you there for and are you doing it? Preventable demand, that could be an external source, and I'm sure you have lots of examples of that. And that's often when another service fails to do something or something right for the resident. We want to understand that because we need to turn that off. And preventable demand, internal and the reasons, and often that is and again, this is something we experience as a council. It's not saying this just happens in advice service or anywhere else, but preventable internal demand. So when there's demand that's created that actually isn't supporting that purpose, isn't actually moving things along, and how are there ways that we can turn that off as well. Next slide, Stephen. Yeah, so this is a similar sort of thing. It's about us coming up with the way we measure that helps us learn about what we can do to change and makes residents' experience of help in the borough, whether that be advice services or food or being, you know, community navigation around services, or when they contact the council. What can we learn about our own processes and how we work with residents that gets in the way of us actually helping them the first time, stops us signposting them elsewhere? Is it about who we need to collaborate with? Is it something about our internal systems and the way that we operate, that we're always sending residents away so they have to come back again? So it's all those things. But the focus around this is on learning. None of this is set in stone. And we're really, you know, we get quite excited when we talk to organisations that go, oh, no, we don't want to measure this. We want to measure this, and this is why. Because it's all about, let's trust that you will use, you know, this is based on you take the money, we trust you to do the right thing. It's why you're in the game, the organisation's doing what it's doing, while you're working in that organisation. But let's work together to try and use that funding to come up with the best ways of supporting residents and actually really exploring what's getting in the way of that. Next slide, please. So I'll hand over to Stephen, and he's just going to talk through the programme. All those things I've been saying earlier, you can ask questions at the end and we can have a good discussion about it, because I'm sure for some partners on the call, it's going to feel very familiar. For others who are new to this, it's going to feel much less familiar. So very happy to answer questions around everything I've just said at the end, but I'll hand over to Stephen now.
Thanks, Claire. And so, as this outlines, this grant programme will be awarding 3-year grants, which is different to the previous programme, which was just for 2 years. The total budget is 1.1 million, but within that, there's 120,000 that's been set aside to be delivered for advice to be delivered from health settings, and we'd work with organisations interested in that to identify suitable health settings and help to broker that with that particular health setting. We're hoping to have all decisions confirmed and approved by December this year, but with the vision that the grants will start from April. But during the January and March period, we'll be working with those shortlisted organisations, with those successful organisations, to kind of build links amongst each other and also to have further discussions in regards to advice in Hackney. As Claire mentioned, what we're trying to do, which is different to other grant funding programmes for advice, is we are funding an advice system in Hackney, and that's how we will be looking at the applications that we receive. So it's not going to be like other funders where they might just be funding 10 advice organisations. We're funding an advice system based on the level of needs and the kind of emerging needs of residents in Hackney. Within the funding, within the programme as well, there will be kind of work with the council, and also what we're trying to do is, where we're funding an advice system, we want to build relationships with, obviously, with the service managers of those organisations, but also want to work with the advisors as well, and trying to kind of link the advisors in with those from other organisations as well. And that is primarily just so that they can actually build their kind of networks and support networks as well. Because what we want to do is, where it was mentioned before, that we would like organisations to kind of support residents based on what they need, and throughout their whole journey to getting the support that they need. We feel that it's best to kind of work with the advisors as well, so that they are able to kind of get the support or tap into other networks as well when they are supporting a resident. In regards to like the wider focus, there's a big commitment now towards kind of place-based working, and so we would this is not a kind of stipulation, but it's kind of, we'd like organisations to consider whether or not they will be able to deliver their advice provisions from other localities in order to reach different communities across Hackney. And there could also be the option, or the opportunity, should I say, to be delivering advice from some of our council buildings as well. We currently are funding some organisations who have recently started to deliver from some of the council buildings, like the HSC as an example, and there could be ways that we could actually work with organisations to broker delivery from other facilities such as libraries and so forth. As mentioned earlier, 120 of this budget is specifically for funding delivery of advice in health settings, and if there is interest from organisations to deliver from health settings, we will work with them and with particular settings to make sure that there's a suitable arrangement for them to kind of go in there and delivering services from that facility as well. How we plan to assess, and I know that there's been a number of questions in regards to the assessment process, is we're going to be looking at the levels of need that we've seen, an emerging need in the borough, and also looking at what the applying organisations have set out as well. It's going to be a very challenging process in terms of like really assessing the applications. But what we're trying to do is really understand what you tell us in terms of your approaches to providing a person-centred approach as well. And kind of looking at what insight we've gathered as well from the voluntary sector, but then also from different council departments as well, about what they've seen as emerging needs and challenges that residents are facing. Not just kind of the challenging needs that they're facing in relation to financial difficulties that they're experiencing. We have deliberately not set a kind of funding sort of basement or ceiling for this particular grant programme, and that is because we're funding an advice system. So we'll look at the range of applications that we've received, and then look at kind of what Hackney needs, and then obviously have discussions with organisations based on the levels of funding that we have available and how much we can possibly award them. We're running a two-stage process. So the first stage will be an application form, and then we plan to shortlist, assess and shortlist a smaller group of organisations, and there we'll have discussions with them to find out more about their person-centred approach, but then also to have discussions with them about the levels of funding that we have available and look towards awarding based on that discussion with them. As mentioned before, like this is we're funding an advice system. Really, it's not just to fund the top 10 applications. Really, it's to fund a system that kind of meets the needs of Hackney residents now and in the future. We've made this a grant funding opportunity and not a commissioned kind of opportunity, because we want organisations, or we would like organisations to utilise this funding in order to leverage in other funding opportunities as well, to bring in more kind of resource into the borough as well. And that's it for me. And now on to any questions that people might have.